Hi, my name is David Bradford, and I'm a part of the engagement team for the Greater Plains Collaborative. This is an introduction to the Patient-Centered Outcomes Research Institute Greater Plains Collaborative Research Network. The purpose of this video is to provide an overview of PCORI, describe the GPC, discuss ways to engage with the GPC, and answer any questions that you may have. The PCORI was first established in 2010 under the Affordable Care Act from funds through the General Fund of the Treasury and fees on private and self-insured health insurance plans. It's an independent, nonprofit research organization that seeks to empower patients and others with actionable information about their health and healthcare choices. It's the leading funder of patient-centered comparative clinical effectiveness research in the US, and between 2010 and 2020, it provided $2.8 billion in funding to over 800 different projects. Research funded by PCORI concentrates on healthcare challenges that confront families every day, including but not limited to cancer, diabetes, maternal mortality, opioid addiction, mental health, and equitable access to care. There are 12 topic themes that inform funding opportunities for patient-centered comparative clinical effectiveness research over the next several funding cycles, in addition to regular calls for proposals. For populations, this includes work focused on improving outcomes for people with intellectual and developmental disabilities, promoting health for older adults, and promoting healthy children and youth. For health behaviors, this includes addressing substance use and violence and trauma. And for health conditions, this includes addressing COVID-19 and rare diseases, improving cardiovascular and mental and behavioral health, managing pain, preventing maternal morbidity and mortality, and promoting sleep health. PCORInet is a national resource funded by PCORI where high-quality health data, patient partnership, and patient-centered outcomes research expertise deliver fast, trustworthy answers that advance health outcomes. The types of research this includes are real-world evidence studies, comparative effectiveness research, population health research, pragmatic clinical trials, health systems research, observational patient cohorts, and more. PCORInet provides access to patient partners and thousands of clinicians with expert knowledge of PCORInet-enabled data, producing meaningful research targets and faster answers. Uniting data allows for research results that are more applicable to and representative of the general population. What is the PCORInet model? The PCORInet model is a collaborative approach to clinical research with a focus on open science, return of results, and dissemination. It features small local studies built into large national studies that leverage the network. It utilizes multiple stakeholder engagement opportunities to optimize discoveries for translation into practice. And it features a common data model with high-quality data with privacy-preserving linkage to other data sources. PCORInet represents data from everyday healthcare encounters with more than 30 million people across the US each year. The PCORInet solution offers access to real-world data. Our 79 PCORInet partnered clinical research sites across 8 different networks work together to help users conduct research more efficiently. And these are our 8 research networks. And these are the locations of the individual sites for each of our research networks. What are some of the unique strengths of PCORInet? In terms of research, our clinical trial and observational or retrospective research capacity for clinical effectiveness research and other research. For operations, our culture of collaboration and learning. For data and technology, our high-quality data, our PCORInet common data model, and our access to a large amount of diverse data. And in terms of engagement, one of our unique strengths is patient-centeredness. The PCORInet front door is the access point for PCORInet resources and services. A knock on the front door can support study design, such as preliminary data for proposals, effect sizes, and potential study power, connections to network collaborators, such as partners to co-design research and people with specific expertise, and PCORInet study designation support. Deeper partnership with PCORInet provides access to best practice sharing, patient engagement, and transparent quality improvement initiatives. In order to learn more information, you can go to this link or scan the QR code here. Engaged communities drive better, faster research. What do we mean by communities? This includes patient and caregivers that have a seat at the table of every PCORNet study, engaging as co-equal collaborators with health professionals, clinicians and clinic staff, insurers, policymakers, and other interested community members. The Greater Plains Collaborative, or GPC, is a network of 14 leading medical centers covering a diverse population of over 35 million patients across 9 states. It is a part of PCORNet, and if you're interested in learning more information, you can follow this link or scan this QR code. And this is a list of the institutions that are affiliated with GPC, as well as the currently available patient data across all of our GPC sites. The GPC's mission is to align our members' clinical and translational science capacity with PCORNet to contribute to national definitive studies and allow our campuses to generalize their research regionally and nationally. GPC uses 4 main processes to support research: research opportunity assessment, sustainability and pricing, data requests, and oversight, administration, and contracting. So for research opportunity assessment, this includes intakes and disseminates national collaboration requests from PCORNet to cultivate proposal development by investigators collaborating with GPC sites submitted via GPC's intake request form. Sustainability and pricing outlines PCORNet infrastructure cost recovery and updates GPC infrastructure cost recovery models and investigator resource guides. Data request oversight, GPC level requests to execute queries and fulfill de-identified, limited, or identifiable data requests following processes aligned with GPC's data sharing agreement. And administration and contracting supports all contracting and administration for the GPC PCORNet contract. Takes the lead for many contracted studies, but also supports sites when studies either contract directly or GPC study will be led by another GPC site. The Electronic Health Record Data Common Data Model. The PCORNet Common Data Model is a specification that defines a standard organization and representation of data for the PCORNet Distributed Research Network. The distributed network will enable the conduct of observational research and clinical trials while allowing each participating organization to maintain physical and operational control over its data. Washington University currently uses version 6.1. The Informatics for Integrating Biology and Bedside, or I2B2, is a self-service and user-friendly tool that leverages existing data for cohort identification, retrospective data analysis, feasibility study, and hypothesis generation. Researchers can query de-identified data from GPC sites using the GPC I2B2 tool. Apart from just numbers, you can also compare the 2 population sets and visualize with demographic, medication, and diagnosis breakdowns. I2B2 allows for easy cohort identification. This is an example query for University of Missouri health patients who are diabetic, positive A1C, and consented for contact. So this yields a cohort of 497 patients. Key requirements for collaboration: have faculty status at a GPC institution or identify a GPC faculty collaborator to work with. Have funding support identified. Projects in the planning stage may still be submitted for consideration if the associated study protocol and draft budget are in an advanced stage of development. Have identified preliminary GPC sites, which would be ideal for your study, and be able to provide the following for review by GPC's ROA committee: a project proposal, a project budget, a biosketch of the requesting party or principal investigator, and documentation that a GPC faculty collaborator has been identified, if applicable, and is willing to work with you on this project. For more information, please visit this link here or scan the QR code. Requesting collaboration, the GPC Research Opportunity Assessment process. This starts with the investigator submitting a research opportunity assessment packet for review. GPC Central then reviews and provides feedback and approves requests. GPC sites review the proposal, provide feedback, and indicate interest, and then provide support for the investigator proposal through a data request, letter of support, and/or a subcontract. In order to submit your request to collaborate, you can use the link here or follow the QR code. Process to request patient counts, de-identified data, or limited data. The investigator submits the DROC data request form. GPC Central reviews and approves the request. GPC sites run the code if applicable and provide data to investigator. This process is valuable for pre-submission information. So these requests can request patient counts for the specific study aims of the investigator at the proposal development stage. Feasibility queries are typically provided to investigators at no cost, and these queries can be distributed and run at individual GPC sites or can be run using GPC's consolidated environment. GPC sites can review these queries and determine whether they would like to participate in the proposal submission. I'll also quickly define patient counts, de-identified data, and limited data. So patient counts are some of the types of counts that are included are patients for observational studies, at least one visit in the past 5 years, patients for trials, at least one visit in the past year, and information about patients with both visit and medication or lab results. De-identified data. All unique identifiers from the source data are further masked. All dates with a random number between 1 and 365 days. Identifiers such as names, postal addresses, except for town, city, state, and zip code, telephone numbers, email addresses, social security numbers, and health plan beneficiary numbers have been removed. And a limited data set may only contain city, state, zip code, elements of date, and other numbers, characteristics, or codes not listed as direct identifiers, such as those mentioned previously. If you're interested, please follow the link here or scan the QR code. GPC's Rapid Patient and Community Engagement, or Rapid PACE resource, provides researchers at any stage in their career with access to patient input at any time throughout the research process, from grant submission to implementation to dissemination. This resource can be used to fulfill patient engagement requirements for investigators applying for PCORNet funding. During Rapid PACE sessions, investigators present their work to members of the Patient Advisors Council belonging to various communities associated with GPC sites. Investigators are asked to present a 10-minute PowerPoint in plain language outlining specific requests for PAC members and dedicate remaining time of the 1-hour session to engaging with PAC members, further discussing the project and answering questions. For more information about Rapid PACE sessions, you can follow the link here or scan the QR code. If you're interested in working with us, please reach out to us via email or phone. Thank you.